Good afternoon. Welcome to Provider Lounge. I'm Chris Mastrangelo, and we are at the annual American Healthcare Convention. Today we have Sheewayne Sandoval from Bencura Rehab. Thank you.
Thank you, Chris, for inviting me. Thank you so much.
We'd love to hear about your company, your rehab company, and what are you foreseeing in the future, your opportunities and challenges, and the viewers would really love to hear about it.
Well, Bencura is a comprehensive rehab company that really specializes in the operations, physical therapy, occupational therapy, speech therapy. I think the really unique thing about Bencura is our collaboration with the facilities. I think, Chris, there's so many changes. You are the preacher of that. So many changes that are happening. And we're looking at the difference between value and volume. And those are the focuses that Bencura is looking at being able to broaden the therapist's train and services, the services that they provide to the facility, finding different ways to help the facility's challenges. Because right now facilities are faced with a multitude of challenges. And these challenges could be anywhere between reducing readmission rates. How can the rehab department be a part of that? Skin integrity, falls, function, of course. All of these things are things that facilities in the future, actually not even in the future, now are being challenged with. And Bencura is set up to be able to help change the mindset of therapists. I can't tell you how many times, how many therapists we've hired where their number one word, as I do site visits, coming out of their mouths is volume, productivity. I rarely hear the word outcome. And outcomes is an area that is focused on and that is looked at in order to achieve what the government is forcing us to do, which I think is very right on target. Quality care is a huge issue as well. Quality care, and really, Chris, I think about the baby boomers. I'm in my 50s. So I think about the baby boomers.
Don't look 50.
The baby boomers, what are they looking for? I think they're looking for quality. It's a way that I tell some of my managers, you know, you want to train therapists to demand quality so they can expect the outcome. Demand and expect.
This is fascinating, and I think you're right on point. A couple of things that I want the viewers to know is that outcomes are important, and that's what the insurance companies are looking for.
Absolutely.
Simultaneously, we want to talk about GMO, and that, well, three things I have to say. Number one is that currently facilities have resources with the therapists,
right,
and they can do a lot more than they probably even realize.
Exactly.
Number two is that the goals and outcomes are something that's going to be part of this recipe. And the outcomes, while they're extremely important and need to be managed, monitored, and documented appropriately, also it's the journey of where was the value of the therapy service delivery, even if the goals, or improvement wasn't made. So don't confuse outcomes with improvement.
Beautiful.
Exactly.
Yes.
That's what I want the viewers to know. Outcomes doesn't mean you improved. It means that we've established a goal for the patient,
Exactly.
with the patient, and we met those outcomes.
Exactly.
And that will bring it together.
Identifying an outcome that's sort of collaborated with the patient, the family, the therapist. And again, it's not necessarily progress, it's necessarily meeting that end result, whatever that end result may be. And I think therapists' mindsets, when they're treating their patients, they need to be thinking, what is this patient's outcome? Are we getting there? Are we meeting that patient's outcome in order for them to achieve their quality, the optimal quality?
And as working in all the continuums,
Yes.
back in the rehab hospitals, on our evals, we would have patient goal. We always baked it into our, and you know, now they're expecting that. Of course we'll do that. That's natural for us. It is resetting the mindset of the therapist, because if the false improvement standard, which existed, that we can only treat because the patient had to improve, we have to reset the mindset so now they understand how to treat in a value-based quality environment.
Value-based, and I think resetting their mindset is key, and having them sort of start that reset when they're first evaluating patients. first interviewing the patient, the family, the goals, having that collaboration, even Chris, with the hospitals.
Yeah, absolutely.
Being able to understand, Bencura, understanding that continuum of care is where our health system is going. It's forcing us to sort of hold hands. It's forcing us to hold hands so patients can sort of fall through each continuum as they reach that outcome, whatever that outcome is. So I think continuum of care is a huge piece. Being able to collaborate with hospitals, being able to collaborate with families, collaborate with home care systems, and helping, as Bencura, helping nursing facilities to be able to position themselves in the community so they can sort of open the doors to hospitals. You want hospitals to be able to want their patients, your facility, to be a part of their continuum of care, because hospitals are running this.
Yes, they're running it.
Yeah, they're running it.
Well, listen, thank you so much. It was great to see you, Sheewayne.
You too.
Thank you so much. Great having you.
You
Talk to
too.
you soon.
Thank you so much.